Dizziness, lightheadedness, and vertigo, they are almost used interchangeably. From a clinical standpoint, how are these different?
To put it scientifically, and what the scientific world accepts now, all these things come under a umbrella term called vestibular symptoms. Vestibular symptoms are basically three. It can be vertigo, it can be unsteadiness, and it can be dizziness. Vertigo is of two types. One is internal vertigo and one is external vertigo. If it is an internal vertigo, then the patient will feel that inside the head everything is spinning. External vertigo means that external visuals are all spinning. In dizziness, the patient loses spatial orientation. It means subject is not well anchored to the surroundings, as if the ground, the surroundings, and everything around the person is not steady. It is called spatial disorientation. Now, in a person who is having dizziness, this sense of position in relation to the surrounding, this gets completely jeopardized, and that is a much worse feeling than the head spinning.
Is vertigo a disease itself, or is it a symptom of something deeper?
Vertigo is not a disease. Vertigo, unsteadiness, dizziness, syncopal attacks, none of them are actually diseases per se. These are all the manifestations of some underlying disease. Vertigo can occur due to a number of reasons, and some of them are very sinister, life-threatening conditions also. And a lot of them, in fact most of them, are very easily treatable, and the person can be cured if the right diagnosis is done and the right treatment is given.
Welcome back to One Health Conversations, a podcast series powered by Pacific One Health, where we break down the biggest health concerns in India through real conversations with experts. I'm your host Vigya Roy, and today we are talking about something that impacts millions but often goes overlooked: vertigo and balance disorders. Did you know that dizziness and vertigo affect nearly 1 in 5 adults every year, with prevalence rising significantly as people age? Yet in India, these symptoms are often misunderstood, misdiagnosed, or dismissed as just old age or stress. That's why today we are diving deep into what vertigo really means, how it affects lives, and what can be done about it. Joining us is one of India's leading experts in vertigo, neurology, and balance disorders, Dr. Anirban Biswas. With a career spanning over 35 years in therapeutic and diagnostic neurology, the medical specialty dealing with balance and hearing disorders. Dr. Biswas has been at the forefront of understanding and treating vertigo in India and beyond. He has led major professional societies, authored foundational textbooks, and shaped how balance disorders are diagnosed and treated in the region. Dr. Biswas, welcome to the show. Thank you so much for being here. Let's begin with a fundamental question, Dr. Biswas. We know that dizziness, lightheadedness, and vertigo, they are almost used interchangeably. From a clinical standpoint, how are these different?
To put it scientifically, and what the scientific world accepts now, all these things come under a umbrella term called vestibular symptoms. Vestibular symptoms. Vestibular symptoms are basically three. It can be vertigo, it can be unsteadiness, and it can be dizziness. Vertigo is of two types. One is internal vertigo and one is external vertigo. The term vertigo implies that there will have to be movement. That means if it is an internal vertigo, then the patient will feel that inside the head everything is spinning. External vertigo means that the external surroundings, the external visuals are all spinning, rotating and spinning. So that is external vertigo and this is internal vertigo. To put it more scientifically, let's use this, that vertigo is defined as a false sense of movement which the patient feels or sees directly outside. it's a false sense of movement. That is, when there is no movement, the patient or the subject is feeling that the subject is spinning or the outside world is spinning. So one thing is imperative. That means for vertigo, there has to be movement, either internally or externally. That has to be there.
Okay.
Now, this movement can be a spinning movement. It can also be a non-spinning movement. Spinning movement means the things are rotating. It's a rotatory movement. And there can also be something called a non-spinning vertigo. People have, a lot of people will have non-spinning vertigo. Non-spinning vertigo means it is not a rotatory sensation, but the sensation is something like as if I am bobbing, I am, say, I am wobbling,
Yes.
I am, the things are moving up and down. There is a visual blur. That means the things are not stable. So it's things that, but one thing is imperative, as I am repeating it once again, that for vertigo there has to be movement, either internal movement or there has to be external movement. That is essential.
All right. And how is it different from dizziness and lightheadedness?
Dizziness is a completely separate entity. In dizziness, there will be absolutely no sense of movement, either internally or externally.
Okay.
In dizziness, the patient loses spatial orientation. What does this term spatial orientation means? It means that the subject will feel that the subject is not well anchored to the surroundings, as if the ground, the surroundings and everything around the person is not steady. It is called spatial disorientation. That means when I am sitting over here, I know that the wall in front of me is 9 feet away. The roof is, say, 6 feet away. Wall on this side is 7 feet away. So, there is an orientation that is there, and I know how I am anchored to this place and how I am positioned over here. Now, in a person who is having dizziness, this sense of position in relation to the surrounding, this gets completely jeopardized. And that is a much worse feeling than the head spinning. So people use the term vertigo for everything. But dizziness and vertigo are completely different entities. Here again, the most important part of dizziness is that there will be no movement. Either the patient will not feel that there is any movement either of the self or of the surroundings. But it's a connection with the surroundings, the anchorage to the surroundings and the ground, that is not perfect. So that is dizziness.
All right. So, but despite how common are these terms, dizziness, vertigo, lightheadedness,
Unsteadiness,
there is a lot of confusion around it.
Yes.
Even for the clinicians,
Yeah.
there's a lot of confusion which persists. Why is it so, and how do we address that?
See, this confusion is there amongst the medical community as well.
Yes.
And that is why the congregation of scientists who work on balance disorders, it is a very special body called the Barony Society, who are basically the regulatory authority, internationally accepted regulatory authority, and a association of professionals who guide everything related to balance disorders.
Okay, so when a patient comes to visit you and for the consultation, what is the most common myth they carry? And if you can please tell our audience.
See, the most common myth that they carry is that they will qualify everything with the term vertigo. And whenever the patient uses the term vertigo, what rings in the doctor's mind is not whether the patient is having dizziness or unsteadiness, or is it a syncopal attack, or is it a spinning attack. There can be non-spinning vertigo also, what you have said. But whenever the person uses the term chakkar aata hai, matha gucche, chakkar aata hai, all these things, then the sense conveyed is that the surroundings are rotating or smooth or moving. So that is a completely different entity, and that arises mainly from diseases of the vestibular labyrinth, the balance organ in the ears, slightly from the diseases of the brain also. But the greater percentage is that. But most vertigo patients or most balance disorder patients that come to a doctor's clinic for their disorders in the balance system, very few of them actually have head spinning. The majority of the patients will either have dizziness or unsteadiness. A large part will be having syncopal, pre-syncopal attacks. But then this umbrella term of vertigo is what they use, and that confuses the doctor, because you cannot expect the patient to be trained. The patient is not expected to give you the correct reply.
Yes.
It is the doctor's prerogative to extract from the patient what the patient is exactly feeling. Because if the doctor is wrongly conveyed, or the doctor understands the patient's feelings improperly, then the investigations advised, the treatment offered will always be wrong. And that is what happens in most cases. In fact, it is now found that of all the people who come to a vertigo clinic, less than 30% actually have head spinning or vertigo. 70% or more than 70% have dizziness, unsteadiness, and all the other things.
And that is why, don't you think that patient awareness is also very important?
It is the most important thing. I was seeing some figures which is given over there, and from the calculations what I could find out is that there are 37 lakh of vertigo patients, of balance disorder patients, I am not using the term vertigo correctly, of balance disorder patients in the NCR. That means the prevalence of vertigo is very, very high. If 37 lakh of people at any point of time are known to have some balance disorder, so that means there are many patients who are having disorders in the balance system.
And these are the reported ones you're talking about. Yeah.
And so see, these things do not come to the forefront, because awareness is abysmally poor, and people confuse this imbalance, dizziness and all as a sign of weakness. They think that they are having low blood pressure, they are having low hemoglobin, or they are having some neurological disorder. So see, that is what most people think. They'll go to a shop and then tell, I'm feeling weak. The shopkeeper will sell them some multivitamin pills and all, and that is how the thing goes on. So out of this 37 lakh of people, only in Delhi NCR, so many people are having balance disorders. How many of them do you think actually go to the right place and get the right treatment? I think it should be less than 0.1%. Less than 0.1%. So that is how it is.
So I think, so that is where, patient education plays a very important role.
Yes.
We discussed how is it also important for a clinician to also know what is it exactly, right?
Like, see, I'll give a small example about this. Since you had been talking about vertigo, dizziness and unsteadiness, a lot of people who come to the doctor seeking redressal of their balance disorders, a huge portion of them do not have vertigo. They do not even have dizziness. What they have is unsteadiness. It's a feeling that I am about to fall, I am not steady. These people, we ask one simple question, that do you feel comfortable if you can hold on to something? He said, yes, if I can hold on to something, I don't even need to touch the person. If my finger even touches something, the wall, or somebody who is walking with me, if I can just touch that person with
then
my finger, I feel very stable. So that is what is unsteadiness. And a lot of these unsteadiness people who are having unsteadiness, they will come to the doctor and say that I am getting vertigo. Because people like to use the term vertigo. They'll come to the doctor and say I am getting vertigo. The doctor does not spend time thinking about what the patient's problem can be. Neither does the doctor ask the relevant leading questions. So the doctor thinks that he must be having a spinning sensation. And when the doctor thinks that he is having spinning sensation, the doctor prescribes anti-vertigo drugs. Anti-vertigo drugs are called vestibular sedatives. The function of vestibular sedatives is to sedate the vestibular labyrinth. The vestibular labyrinth is a very special and a very sophisticated organ which we have in the ear, which actually senses any movement of the head. And when that vestibular labyrinth is damaged, you can get that spinning attack. So the vestibular sedatives that are used, or the anti-vertigo drugs that are used, their main function is to sedate the balance organ. Now, in a patient who is having unsteadiness, if you sedate the balance organ, then the patient will be liable to fall. Because that patient needs more input from the vestibular labyrinth to the brain to keep steady. And in that patient, due to wrong communication from the patient to the doctor or due to the doctor's poor understanding, if that patient is prescribed anti-vertigo drugs like beta-histine, sinerizine, prochlorperazine, dimenhydrinate, meclizine, these are the common anti-vertigo drugs, and these are all symptom-relieving drugs. So when these patients are prescribed these drugs actually sedate the balance organ. I am repeating that over and over again to send the message loud and clear that when these drugs are prescribed to patients who are having unsteadiness or dizziness, you are actually harming the patient more than being of any help to the patient.
So not only
the communication gap.
So not only the case or the condition is getting misdiagnosed, it is getting mistreated as well.
Yes, of course.
Yeah.
Misdiagnosis will always lead to mistreatment.
Mistreatment.
So the awareness which you are talking about has to be there not only in the patient's level but at the doctor's level also.
Yes.
This differentiation has to be done.
Yes. Again, a layman question,
Yeah.
Dr. Biswas. Is vertigo a disease itself, or is it a symptom of something deeper?
Yes, vertigo is not a disease. Vertigo, unsteadiness, dizziness, syncopal attacks, none of them are actually diseases per se. These are all the manifestations of some underlying disease. We get so many patients who have been to different places and they have come with the diagnosis of vertigo written over there. It actually means nothing. What the doctor has done, with all due respect to whoever has seen the patient, is that the doctor has basically translated the patient's language from Hindi. The patient must have said chakkar aata hai. He has written vertigo. Vertigo is the English translation of chakkar. Vertigo is not a disease by itself.
Yes.
You are paying the doctor, or even if you have gone to a clinic, which is a free clinic, the doctor's job is not to translate your thing into English. It's the same as saying that you are having fever if I go to you with bukhar. You don't write fever. But in vertigo, but in these balance disorder things, what happens is that the doctor will write vertigo. The doctor's job is not to translate the patient's symptom into English. The doctor's job is to find out why is the patient having the vertigo. Vertigo can occur due to a number of reasons, and some of them are very sinister, life-threatening conditions also. So, and a lot of them, in fact most of them, are very easily treatable, and the person can be cured if the right diagnosis is done and the right treatment is given.
Yes.
So, see, this is where all these things, constraints come in, and that is where we need to intervene.
Yes.
And that is what is uppermost in creating patient awareness and things like that.
Absolutely. So, Dr. Biswas, we also know that vertigo is widely experienced. It's experienced globally, rather.
Yeah.
But what does it look like here in India? Are we seeing rise in cases as well? As you said, also 37 lakh cases just in Delhi NCR.
Yeah.
But all across India, if we talk, how does the number look like?
See, there are different epidemiological studies. There are different epidemiological studies carried out in different parts of the world. In India, we do not have many such studies. Very few studies are there. But internationally, a lot of studies have been done. There, different studies have taken in different groups of people. Some have been done on aged persons, some have been done on middle-aged persons, some have been done on children. So there are lots of different studies, and also a lot depends upon what the person who is doing the research work, what did they consider as a balance disorder.
Yeah.
In some studies, they have only taken vertigo, head spinning. Some people have taken unsteadiness and dizziness also. See, it depends upon what is their inclusion criteria.
Yes.
But in general, the prevalent figures which are accepted worldwide is that 15.8% of the normal population has balance disorders. 15.8% is a huge number.
It is.
And so this was as per a German study, but then the general figures are anything from 5% till about 37-38%. But then on an average we can say that 15.8% of the normal population will have some balance disorder.
All right.
So it's as high as that. So it's a pretty common disease.
Yeah. So, and do you also think that younger people now experience vertigo more often now as compared to the earlier times?
Yes, two things are there. See, balance disorders are basically an old age problem mainly.
Okay.
It's not that the younger people, children or the middle-aged people will not have vertigo. They also have these people also do have a huge, they constitute a big number. But what we are finding nowadays is that people in the age range of say 25 to 40, a huge percentage of them are now coming to our vertigo clinics with balance disorders. This I think has been happening for the last say 10 years or so. But before that, we used to seldom get people in the age range of say 20 to 35 coming to us with a complaint of vertigo. One reason can be stress. The other reason can be very poor lifestyle. Then another cause, is that a lot of people who come to a vertigo clinic, a big percentage of them, the vertigo is due to a migraine diathesis. That means they have migraine in them, which is not manifested as headaches, but it is manifested as a balance disorder. A lot of people come to us who have a migraine diathesis. So migraine can be manifested in different ways. Headache is just one way. A lot of people will also have migraine who are manifested with balance disorder. Now, if the balance disorder, vertigo, head spinning, this unsteadiness or dizziness, if that is due to migraine, then this lifestyle changes jeopardizes their condition tremendously. Because if you are having a migraine diathesis, then the most effective treatment is lifestyle modification.
Yes, okay.
So that lifestyle modification is very important for these people. But nowadays the younger generation, they are all used to having very large part of their day spent on seeing mobile phones and computer screens.
I was about to say that screen time is more now.
Then late nights, not having food at the right time, having different types of food which induce migraine attacks more. You see, so the entire scenario is changing now, and I would say in my clinic, about 30% of the people that I see now are in the age range of say 20 to 40 years of age. This is something very new, which is not there previously.
Okay, so Dr. Biswas, we also know that we want to know that for someone who suffers with vertigo and is untreated for a longer duration, either they do not know that this is vertigo or they have not reached to the right place. What does that mean in their daily life, mentally, socially, or even professionally? How does the delay affect?
I think it would not be proper to quote me, but then God, for some sadistic pleasure, has connected our balance system with our psychic system. I don't know what pleasure God got out of it, but then it is somehow connected.
Yes.
And psychic disorders very often manifest with a balance problem, and balance problems lead to psychic disorders. Yeah, so this is there. It's an interchangeable thing. One perpetuates the other. This is one part. The balance system is connected with the psychic system, and the balance system is also connected to the cognitive system. So these people who are having long-standing balance disorders, they develop psychic problems. They develop cognitive problems. About 50% of balance disorder patients have cognitive problems. Cognitive problems means their executive functioning of the brain, that gets jeopardized. Their thinking process, their mental capabilities, their powers of recollecting things, storing things into the memory and retrieving things from the memory as and when required. So all these things take a beating if the patient is having balance disorders for a long time. And so they have psychic problems also, because the long continued balance disorders, they induce diseases, psychiatric diseases like anxiety and depression, mainly anxiety. It's the other way around also. I'm stressing on this over and over again. It's the other way around also. Psychiatric disorders will induce balance problems, and balance problems will induce psychiatric disorders. So if a person is cognitively or psychologically wrecked, cognitively or psychologically the patient is impaired, the cognition and the psychic system is impaired, the patient's quality of life goes for a toss. The subject performs poorly in all spheres of life. The person will not be able to give his best in his workplace. And in today's world, if you are not outperforming yourself every moment of life, then you are buried. That happens. I am a 70-year-old. Remember that.
Yes.
To me also that happens.
Yes.
And so we have grown up in at times when competition was nowhere near what it is today.
Yes, absolutely. So the professional
even
life
today,
gets,
I have to outperform what I had done yesterday.
Yes.
So that is the thing, that being in a profession, for any profession, not in the medical profession, you have to be the best.
Yeah.
Otherwise, you don't survive.
Yeah.
So if you are cognitively or psychologically
Affected or
means impaired, then how will you perform?
yes.
Your quality of life will suffer. So everything. Financially, you will be wrecked. So everything. So that is why we need to intervene.
Yeah. So, and many people also think that it'll pass and they normalize the symptoms. How does the delay affect in day-to-day practice and daily life? How does that affect?
Okay. See, we had been a little unjust with God, I think. Said that God, for some sadistic pleasure, has connected this with our psychic system.
Yeah.
But at the same time, God has also been kind enough to ensure that most balance disorders, rather not balance disorders, let's put it this way. Vertigo is usually a self-limiting condition.
Okay.
It goes away by itself
Okay.
after some time. But if a pathology is there, it will recur. It will keep on recurring. That is what we need to find out. But most diseases that actually called head spinning, that means vertigo, internal spinning or external spinning, most of these diseases are self-limiting diseases. Like, I'll give
What do you mean by that? Also, please explain.
Self-limiting disease means if you are not caught hold by a doctor who is incompetent in handling balance disorders, the disease comes down by itself. The symptoms disappear by themselves.
Okay.
I'll give you one or two small examples. Like, one common cause of vertigo is benign paroxysmal positional vertigo, which we call BPPV.
Yeah.
BPPV in most cases disappears, goes away by itself in 5 to 7 days time. The patient's symptom will be that whenever the patient is lying down or getting up, turning towards one side in bed, looking up, looking down, the patient will have a few seconds of vertigo. It's a very common disease.
Okay.
Now this, if nothing is done, it goes away in an average of 5 to 7 days time. Sometimes it goes away in 2-3 days time also. What happens, these people will go to a doctor, the doctor will give them the vestibular sedatives, and when the doctor gives them the vestibular sedatives, which have got absolutely nothing to do with BPPV, when the doctor gives them vestibular sedatives, you are actually sedating the balance organ, which is not necessary. So if you sedate the balance organ, then the balance system starts malfunctioning. It will not function. We need a very, very sophisticated and a very sensitive balance system. Why I am coming to that later on. I just told you about BPPV. Another example would be, say, vestibular neuritis. A vestibular neuritis patient will get a sudden attack of vertigo, severe vertigo, which will be lasting for 1 or 2 days, and then it subsides by itself. In 4-5 days time, the patient is absolutely normal in most cases, 90% normal in most cases. So that is also a self-limiting disease. So most of these diseases are self-limiting. Meniere's disease, if you get an attack of vertigo, that attack will never last more than 12 hours. anything between 15 minutes to 12 hours is Meniere's disease. And so even if you do not do anything to the patient's symptoms are going to come down by itself.
Okay.
So God has been very kind that for actual head spinning, vertigo, mostly, not always, but mostly these are, mostly means 90%, 95%
Okay.
are self-limiting. They go away by themselves. Patients think that they have become cured. That does not happen. So it can recur again, but as and when it recurs, then again they come to the doctor and something takes place. But point is that mostly these are self-limiting disorders, and so many people get cured of the vertigo. They think that they've taken some pill that has cured them. They think that they've put some Godman's ashes on their forehead, that has cured them. Somebody may have also undergone some brain surgery, and then they will think that has cured them. It is not like that. In most cases, the thing subsides by itself. And so that is one way.
Okay. What do you think is the most common cause of vertigo that listeners should know about? Because people should know that what is causing vertigo, So what is the most common cause?
The commonest cause of vertigo is, say, benign paroxysmal positional vertigo. If you are using the term vertigo, I am not bringing into this dizziness or unsteadiness.
All right.
So if it is vertigo only, then the commonest cause would be BPPV. Very close second would be migraine related vertigo.
All right.
So these are the two commonest causes of vertigo. So how does the patient know about it? The patient will, the symptoms are very typical in BPPV, as I have just said, that whenever the patient is changing position, lying down, getting up, turning towards one side, looking up, looking down, there will be a few seconds of vertigo. The patient will try to pick up something from under the sofa. Suddenly the patient will get head spinning. The patient may be trying to clean the ceiling. Patient will get an attack of vertigo. Getting up from bed at morning, the patient will get a few seconds of vertigo. So that is BPPV. So that is the commonest thing.
Okay.
So nowadays you see, giving lectures, writing about these things, many people have become quite aware. So when a patient gets symptoms like that, more often than not, the patient will come and tell us, "Sir, I think I am having BPPV." So that way it's fine. And
so then they know what is BPPV is.
Yeah, so that is good.
Yes.
They're definitely good in a way.
Yeah.
And if the patient knows also that if the patient is having BPPV and the patient can survive for the next 4-5 days with this, in most cases it subsides. And in BPPV, the typical thing that usually happens, I'm not talking about each and every case. On the first day it will be maximum, second it will be a little lesser, third day it will be a little lesser. In 5-6 days time it will go away. It's not for every case, but for most cases. So when these patients come to us for BPPV, we look into their eyes and we can find out what is the pathology. The pathology in BPPV is that some particles inside the inner ear, inside the balance organ, they get dislodged from one place and go to another place. So by looking at the eyes, we can find out where from the particle has been dislodged and where has the particle gone into, and then we do a maneuver to put the particles back into the original place. And if it has been done correctly, it's an immediate cure. Cure.
Okay.
So it's not that bad. So these patients do not need any medication. There is no scope of any medication in a person who is having BPPV.
All right. So we often hear about migraines, anxiety, even nutrient deficiencies. You talked about anxiety, stress level, bad posture, more of screen time these days.
Yes.
But can we also talk about nutrient deficiencies and how do these connect with vertigo episodes?
It's a little difficult to answer, but then the point is that what science has been able to show is that endocrine disorders and metabolic disorders, electrolyte imbalances, they are a very, very common cause of a patient presenting to the doctor with vertigo, imbalance, dizziness, etc. So in most of the patients, we need to have a complete biochemical tests, series done. We do the hemoglobin levels, the complete blood count done. We look for the thyroid status, the glucose tolerance levels, vitamin B12 level, vitamin D level. So all these basic things we carry out in for most of the patients. So we have an idea whether this is being caused by any endocrine disorder, any metabolic disorder, or any other systemic disorders. Like see, you are talking about this. One of the commonest cause is hypotension, sudden fall of blood pressure. They give the patient a sinking sensation. Since we are limiting ourselves to balance disorders, sinking sensation is a closely related to a balance disorder, but in the strictest sense, it is not a balance disorder.
Okay.
Sinking sensation means you get a feeling of a blurring of vision, blackout, impending loss of consciousness, as if I'll fall down now. So that is a sinking sensation.
Okay.
So that also is mostly due to low blood pressure. You ask the patient, do you have low blood pressure? Patient says, no, sir, I don't have low blood pressure. Actually, I have very high blood pressure and I'm taking 6 pills for my blood pressure. I take this, so I don't have any issues with pressure. My pressure remains under control. What happens in most of these patients, that these patients are over-medicated with antihypertensives, and so when the patient is over-medicated with antihypertensives, at certain point of the day, the blood pressure level comes down tremendously, and these patients will have a sinking sensation, and these things. So whenever we get patients like this, the patient will come and say that I was standing in the queue, I was talking to somebody, and suddenly I felt that I'm falling down, and so I sat down, and this keeps on happening. So we tell these patients that whenever you get this thing at home, you keep a blood pressure instrument, a pulse oximeter, and a glucometer ready with you, so that whenever you get this sinking sensation, as if I'm losing control of my body, I'm trembling, I'm about to fall, or there's a blurring of vision, you don't need to have a blackout and fall onto the ground. Whenever you have something like this, immediately check your blood pressure level with a pulse oximeter, test your oxygen concentration, pulse rate, and with the glucometer, see whether you are having any hypoglycemia or not. These things keep on happening. There are a lot of people who do this peculiar diets. They will eat only once in a day. A lot of these new concepts have come in. They will eat, say, once in a day. After that, they will not eat. Many of them develop hypoglycemia off and on. And so when they develop hypoglycemia, they'll have the same feeling. They will also come to you and tell you, chakkar aata hai, I'm getting vertigo. So when you take the history, when you take this, so one of the questions which is asked in our clinic outside, that whether the patient is pursuing any weight losing program or any of those diet changes and all, because if that is so, we presume that the patient may be having hypoglycemia, and to all these patients we say that you keep a glucometer always with you, so that as and when you get this sensation, immediately test your blood sugar level. Very common now. So these are things which are related very much to vertigo, and these are more common than a disease in the vestibular labyrinth.
So related to that, Dr. Biswas, are there any red flags where someone should seek urgent medical help?
See, all these features can be due to sinister diseases also.
Okay.
So you never know which one is causing what, and it is always prudent to seek a medical advice as and when required. But you see, in all these things, the patient is himself the best judge. We are not wanting our hospitals to be filled up with vertigo patients. That is not what we aim to do. But at the same time, we also have to ensure that we are not losing out on sinister, life-threatening conditions. I'll just give you one small example. About 10 days back, one of my classmates' daughter was sent to me by my classmate. Okay. The daughter is 38 years old now. She came to me with this thing that I am feeling sinking, I am feeling persistent head spinning, I am feeling that everything, I am losing control of my body, feeling very weak. I said, since when? Sir, from today morning. Said, yesterday you were fine. Yeah. Suddenly today morning you are having this vertigo and you have come to me. So I looked into the eyes, no nystagmus, no nothing, no sign of vertigo. Then 38-year-old patient, what can you expect? Then somehow it was appearing to me that she is looking very pale and tired and something like that. So I asked her that, what is your hemoglobin level? No, it's fine. I am, my blood test was done 3-4 weeks back. I said, why? Did you have any problem? No, actually, I am possibly pregnant. So I had missed my periods. And so my husband said, you go and get a blood test done to see if you are having pregnancy. And so what did he said? They said that no, it's too early, we cannot give you the result. So that rang a bell, and I thought whether she is having any pregnancy related issues or not. So I looked into the eyes then, which I did not do the first time. I looked for nystagmus, that is any eye movement which is typical of vertigo. That was not there. But when I looked into the eyes again, I found that she is severely anemic. So I said that you immediately go and get a ultrasonogram of the lower abdomen done. I thought it could be a tubal pregnancy. In a tubal pregnancy, what happens is there is a pregnancy in the fallopian tube, and that sometimes bursts, and then there is a continuous incessant bleeding inside the abdomen, and the tap is open, it's continuously bleeding. And so when I send the patient, they said yes, the patient is having a tubal pregnancy and it's bleeding heavily. She is having a hemoglobin of 4.1.
Oh my God.
2 weeks back, the hemoglobin is normal. See, these things are extremely sinister. Had that patient not come to me, had it not suddenly, these are not things that we see regularly. So it was by just a stroke of luck that I looked into the eyes. I would not look for anemia, though I am supposed to. I would not have looked for anemia in a patient who has come to me with only sudden head spinning.
Yes.
Why should I look? So the point is that these things keep on happening. So the patient has to be lucky, the doctor has to be lucky. Then only you can find out what exactly has been happening.
Yes.
So there can be sinister causes also. This cannot be taken lightly.
Also, Dr. Biswas, many patients feel, in just the case you mentioned, they feel that getting a correct diagnosis will take forever. Why is vertigo harder to diagnose than other conditions? Or is it harder to diagnose?
It is very difficult to diagnose, that is true. Why is it difficult to diagnose?
Yes.
Because in vertigo, in all balance disorder patients, you need a very thorough history taking, which is not done. Nobody has the time to take a very detailed history. That does not exist. In very few doctors who are into the practice of vertigo solely and wholly, they will afford the time. Like see, in our clinic, we spend in the clinic 12 hours to 13 hours every day. We see a maximum of 12-13 patients per day. Each patient takes more than an hour. So the point is, a very detailed history taking is necessary. That nobody has the time to take. In vertigo, in balance disorders, a lot of investigations are done. Most of them are unnecessary, useless, misleading in tests. The tests that are done on the guise of testing the balance system are wrongly done in most cases and are unnecessarily done. So the results that come are very often misleading, and very often the doctors will advise for an MRI of the brain or something like that. Not that they should not be done, but the yield rate or the hit rate with an MRI is very low in a vertigo patient. So it's difficult to diagnose it, because if the doctor depends only on investigations, the doctor is bound to miss.
Yes.
The doctor will have to take a very thorough, very detailed history, and also do the clinical tests properly.
As well, yes.
That clinical testing, neurological clinical testing, neuro-otological, that means balance testing, and a general examination. Like say, this is the minimum that needs to be done. You have to make the patient lie down in the bed, take the patient's blood pressure level, suddenly make the patient stand up, take the patient's blood pressure, and then again after 3 minutes, 6 minutes and 10 minutes, the blood pressure has to be taken. The doctor does not have so much of time. So the point is that we in our clinic, how will I wait for such a long time? No? So it is done outside by our staff over there. But then if you miss out on these things, you will be missing out on a lot of patients who have come to you with pre-syncopal attacks. Then in the history taking, a big part is some questionnaires that need to be filled up, which are called the Dizziness Handicap Inventory.
Okay.
Then there is something called HADS, Hospital Anxiety Depression Score. Then MMS. So these are different types of things, questionnaires, which the patient has to fill up, so that when the patient is entering my room, I know what is the status of the physical impairment, what is the emotional impairment, and what is the, say, psychological impairment. So that is what we need to know. We need to know how much anxiety this patient has, how much depression the patient has, what is the cognitive status of the patient. Without having this entire information, you can never ever do justice to the patient, because most of these vertigo patients have a huge comorbidity, and the comorbidity is related to this psychic system, cognitive system, and other systems also. So until the patient is dealt with holistically, investigations have to be holistic, treatment has to be holistic. That does not happen, and if that does not happen, you are actually fooling around with the patient. The patient comes to you and you just try to do anti-vertigo drugs. Actually, you are deceiving the patient. It does not work that way.
Also related to what you just said, Dr. Biswas, how important is good old clinical examination as compared to the new gadgets and scans these days?
Clinical examination and history taking in a patient of vertigo is 95%, maybe 98%. The investigations and everything together will count for 5 to 10%. But you see, the narratives prepared and the commercialization of the investigations and these different pills and all, so that has changed the mindset of doctors, and these instrument companies, they will come and propagate that you do this investigation, they will tell you everything in a much better way. Why are you wasting time on taking the history? It's a waste of time. We'll do the investigations, and everything the investigations will tell you. Nothing can be more of a tomfoolery than this. So this is basically cheating, and this is what happens. You cannot do anything about it. So the history taking and the clinical examination are the cornerstone, the mainstay of evaluating a balanced disorder patient, and this cannot ever be overturned, or this cannot ever be substituted by the so-called vestibular function test and the other tests. You are talking about tests. You see, regarding the vestibular function tests also, it is now found that rather than the so-called vestibular function tests like VNG, VHIT, VEMP test, and there are a plethora of tests, we get much more of information from other tests like, say, biothesiometry, temperature sensation test, then ABI, ankle brachial fistula. These are different tests which tell us how well the proprioceptive system is working. We are talking only about whenever a patient of vertigo comes to us, we are thinking about the vestibular labyrinth. But in a normal person who is in a lighted room, who is standing on a surface like this, on a stable surface, it is the proprioceptive input that controls balance in more than 70% of the time.
And what is that?
It is the proprioceptive system. That means we have got some sensors in the soles of the feet which sense the stability of the ground where I am standing, sitting, or lying down. So these sensors tell the brain about the stability of the ground where I am standing. In most of the time, our body's balance is maintained by the proprioceptive input, not by the input that we are getting from the vestibular labyrinth. So this is a wrong narrative that is created by pharma houses and by the instrument sellers. They try to divert attention from these basic things into high-tech different investigations. Their high-tech investigations can be done. They will have to be chosen and done for the right patients, and if they are done, they will have to be done properly. But these are much more simpler tests with much cheaper instruments by which you can measure these things. The proprioceptive, by testing the proprioceptive system, it's a very cheap test. So these are the things that need to be done. So clinical examination is very vital, as I told you.
All right.
This was your question.
Yes. Dr. Biswas, you also mentioned that a lot of healthcare practitioners, they give sedatives, and you've strongly put your point. And why do you think these are doing no good and they are not solving any purpose? And you were very strongly putting that point. Why do you think that these are doing bad rather than being good?
See, I had mentioned the names of the drugs also.
Yes.
See, these are commonly prescribed, and doctors do a permutation combination of these 2-3 drugs, and then every patient is given these drugs. See, these are vestibular sedatives.
Yeah.
What does a vestibular sedative mean? It means a medicine which will sedate the balance organ. The balance organ, the vestibular labyrinth, you are wanting to sedate the balance organ. Now, God has given us, or nature, whatever you believe in, has given us a very, very sensitive balance organ. The heart beats 72 times per minute. But the balance organs of both sides are discharging spikes of 85 to 90 spikes per second. This one is giving 85 to 90 spikes per second, and this one is giving 85 to 90 spikes per second. It means every second there are nearly 180 or at least 170 spikes that are taking place, and these balance organs are working in unison so that I can stand erect.
So when you say spikes, what are these?
These are electrical discharges that actually emanate from this, and they send impulses to the brain. The brain understands how my body is moving.
All right.
Because we are always moving. This is something which patients have to understand, that we are always moving. We are standing on earth. The earth is revolving at 1129 miles per hour. It is revolving around itself. And the earth is rotating around the sun at a speed of 67,800 miles per hour. So we are standing on a platform which is always
Also
moving very fast. So to maintain balance over here, we need a very sensitive balance organ. Gravity is just anchoring us to the ground, but to stay erect, we need the help of the entire balance system, which is partly in the ears, partly in the brain, and partly spread over different parts of the body. Now, if you are using vestibular sedatives, you are actually sedating the balance organ. So you are actually putting down what God has given you to maintain your balance. So if you put the patient on these drugs for some time, the sensitivity of the balance organ goes down. And if the sensitivity of the balance organ goes down, you will start feeling wobbly. You will start feeling unstable. Because when the body is moving, when you are walking, when you are putting the right foot, the body is tilted to the right. Brain has to immediately understand that the body is tilting to the right, then automatically it will cause a contraction of the muscles of the left side of the body so that I become straight.
Maintain the balance,
but when when your balance organs are sedated, and then the brain cannot sense this so well, and so the patient will walk unsteadily, the patient will become wobbly, the patient will tend to fall, and that is why the current teaching is that even if a patient has very severe head spinning, do not use the anti-vertigo drugs for more than 2 to 3 days. In fact, we do not prescribe any of these drugs in our practice, and if ever, we give it for 1 or 2 doses only. We try never to give it for more than 1 or 2 doses. And more of these beta-histine, serotonin, these drugs, these are all not FDA approved drugs. So these are not allowed to be sold in US and some other countries. So this is what our patients should also understand, because if the patients feel that with the head spinning, they had taken this drug and the head spinning has come down, they keep on taking it. So that destroys the balance system much more. So that is why we are dead against use of these drugs so rampantly.
Thank you so much for your insights. But before leaving, I would ask if there is one message, one thing you want our listeners to take away from this conversation, this podcast, from you and from Pacific One Health, what would that be?
See, number one is that patients will have to know that there is an overuse of anti-vertigo drugs which is detrimental to their balance system's health. So that has to be curtailed, that has to be stopped, and that has to be reduced as much as practicable. We would not definitely want the patient to keep on getting the vertigo and do the vomiting. That is not there. But the underlying cause for this will have to be found out, and that will have to be treated. So that is the patient's prerogative to guide the doctor in the right way, number one. And number two is that balance disorders should not be taken lightly. They can be caused by a lot of sinister diseases also, but at the same time, it is not, in most cases, it is not something which is very life-threatening. Life-threatening diseases causing balance disorders will be about say 2%, 1 or 2%, not much more than that. So it's not something to be scared of, but it is also something about which people should not be taking it very lightly or as a sign of weakness or something. They have to give due importance to it and ensure that it is treated ethically, honestly, and scientifically. That is all.
Thank you. Thank you so much, Dr. Biswas, for breaking down the myths, the science, and most importantly, what I feel is that creating a hope around vertigo and balance disorders. So thank you so much for your insights. Thank you for being here. And to our listeners, if you or someone you love is living with dizziness or balance issues, remember, help is available, answer exists, and effective treatment is possible. We'll continue bringing you conversations that empower you to take charge of your well-being. Till then, keep listening, stay healthy, and stay informed. This is your host Vikya signing off, and remember, better health begins with better conversations.